thank you. So I'm not going to do any big introduction, but I do love this photo of me. This was one of my first trips to India, and myself and my colleague Barbara Harper from America were invited to speak, and this was the room we were put in. If you can read behind me what it says, the School of Ancient Wisdom, and Sue just talking about, you know, our history of where we've come from with midwives. I just thought it was brilliant. So I often use this because it just feels to me exactly where I've come from. There is ancient wisdom even around water births. So yeah, I'm not going to go through what I do because Sue very kindly has shared most of it. However, Sue wanted me to talk about the water birth research tonight, and the title she gave me was Calm Seas or Stormy Water. And I guess over the years we've done exactly that. We've had some very calm times with water, and we've had some very challenging times with water, and not just during COVID. I have to stress, we had very similar storms when HIV and AIDS first came out, and some of us obviously worked all through that, including with water. So the first couple of slides are just slides that I use. If you've ever heard me teach, you'll know. I very much passionately believe that if we're going to provide that information to women, we need to have the quality of research. And that's not just the quantitative, the facts and the figures, but we need that qualitative research. And those are just two very simple definitions that I share with parents as well when I'm teaching. It isn't just for professionals, because I think sometimes people can get very mixed up with research, and both I feel are as important. For some of us, maybe the facts and figures, the quantitative stuff is more important, but I think from a woman's point of view, they need to know both, and that's what I'd like to share. And in the last couple of weeks, there's been an awful lot of new water birth information coming out. Some I haven't even had a chance to read yet. And that won't be going to Bali with me. I'm going to have enough reading. But certainly the things I've picked out for this evening, I hope show you what happens when the research or the stories often come out. So yeah, that was the title, and just picking out some of the photos. I've been incredibly fortunate over my career for women willing to share their birth stories, and particularly their photographs. And this is just a tiny sample of around the world, colleagues, parents who have shared their stories. And I think I always say a picture says 1,000 words, and I hope that bears out from what you can see there. Couple of women with complex needs, baby Imogen, top right on my screen, just opening its eyes up for mum. She had a high BMI and wanted a home water birth. Caroline in the centre, previous caesarean section, when VBACs, let alone VBACs in water and at home, were all, oh boy, what do we do with this? And a colleague from where I was working who had GBS as well. And then the two women at the bottom just showing the huge diversity around the world. We now believe there's about 119 countries who actively support water birth. And the word is actively support, not just say we have a pool. And when the women ask, well, how many women use it? Or how many water births did you have last year? Either the midwife or whoever's showing them around can't answer, or are embarrassed to answer, or just don't know. So the word actively support is what I use a lot when I'm talking about water births. So we have Taiwan bottom left and India bottom right. So water birth really is an international style of care. So this is just a slide. If you've heard me speak in the last year, you will have probably seen this slide, because what I do every time new research comes out, having read it, if I believe it adds something to this one slide, because there are hundreds and hundreds and hundreds of studies, what I do is add it to this, and then I remove the last one. So the Winjin study at the top from China. I always give a quick example of why these particular studies are there. And the biggest thing I think that comes out probably from that study is the numbers. Over 5,000 women in that study. And that's big because so many of the studies, still valuable, but are much smaller. Also, the huge cultural differences with birth experiences, birth care, and birth rights, not as in legal rights, but about, you know, cultural rights. And of course, that's very, very different in China. This particular unit, like many, had very, very, very high caesarean section rates. So introducing water, they changed the whole attitude to birth. And, you know, great credit to them. The Jacobi study is interesting, quite good sized numbers. One of my things I always say is it's so important we collect the data, whether you're doing 10 a year because you're a freelance or an independent midwife or on your own. That might be, you know, one a month, that might be correct. We still need the data. So it doesn't matter how big, but we do need to collect it and publish it. And I have to say, Canada, even though they've been doing WaterBirth since the early 1990s, have been really slow at publishing, despite me nagging everyone everywhere I go. Please, please publish. And we can help with that. One of my hats is as governance lead for WaterBirth International. And we have researchers around the world who will help with that. So please, it's a plea there. Please publish, collect your data and get it published. The SNAP trial, large numbers again, 10,000 women. This was unusual in America because this was the hospitals and the birth centres collecting data and analysing it together. Now, anyone who knows anything about healthcare in America may appreciate what a big challenge that was. So that's why they're there, because they pulled together as midwives working in different environments, but doing similar things, WaterBirth, but they've pulled their data together to get it analysed. The Harris study, which is now completed, this was the first time that 35 trusts in England got together to collect their data. I did one many years ago and there was 10 units joined together and we thought we were doing fab, but she managed to pull 35 units who joined together to collect their data. Now, whilst the outcomes that you'll see in a moment in these units are all very similar and very good, what was interesting that came out from those 35 different units was the equality. How many women actually used the pool? And Sue sort of alluded to that, the access. And it wasn't just access, it was also looking at the ethnicity and the social economic backgrounds of women. So it's not equitable at all. And that came up very clearly in that study. Now, the Barry study, and you know, this is now in Ireland, so Republic of Ireland. This is Paula Barry's study in one of the most well-known hospitals, the Coombe in Dublin. Small study. This had to be for her to move the project forward, a randomised controlled trial. And that's often been one of the criticisms of us as researchers, that we haven't got many RCTs with WaterBirths. Well, sometimes you have to explain why. When I explain it, I do remind people that, you know, there's lots of different types of research. And an RCT by many, particularly our medical colleagues, will often see that as the gold standard. But you only have to look at even some of our own national guidelines, things like NICE, that actually they haven't even got RCTs as their evidence. And yet we're often hammered for not having RCTs. So Paula's study was an RCT, 190 women, and you'll see in a minute the results are all very similar. The Borberg study from America is another uniqueness of them. This was the home birth and the birth centre midwives also joining together to collect their results. And the results for both of those different environments, birth environments, were equal on everything they looked at. And then the most recent one that's on here is the SEED study, and it only came out last year. And this is from Australia, and we've nagged Australia for many years about not producing their data. So they have at last. It's not a huge study, but what really came up from their study wasn't about the outcomes, but it was about the number of women who could have been eligible to use water compared to those who actually did. So we're back to having an equitable service, and they, like many places, have exactly that problem. So what do we want from all of these studies? I'm not going to read it out. You're all able to do that. But, you know, very basic clinical outcomes, things that sometimes can be challenging, like what other analgesia is used in the pool, and that varies greatly around the world. From the baby's point of view, normally the only basic outcome we get recorded is an APGAR score, and that's universal. Everyone uses an APGAR score. So these studies you've just seen all report the outcomes in water were as good as, and in some cases better than, dry land. Now that's very powerful to share with colleagues, but of course, remember I said this is with women as well. Complications were extremely rare, and that's not to say they don't happen. You're going to see that in a slide in a moment. But from my point of view, my role, I hope, is to try and look at that outcome and see, was there something that we could have done to help before it got to that point? I'll explain it more when we get there. So that's a real basic introduction to research that I do when I'm talking. So this is one of the very new ones that came out. You can see it's only, you know, literally a couple of, I think it came out in March. And this was looking at neonatal outcomes. And we don't get many studies done for neonatal outcomes with WaterBirth. So we have to congratulate the Italians for doing it. Not a huge study again, and we recognise that. 144 water deliveries and 265 land deliveries. They were the number of women who were identified. And that's the one I said about complications being rare. They had 4 in water of neonatal convulsions. Now, this happened in a study a few years ago in Turkey, and we backtracked, myself and Barbara, and one of the things that we felt was that there was a degree of uncertainty about bringing the babies out of the water. In fact, we felt people were snatching the babies out, and that's not just professionals, that's parents as well. And then the cord snaps. And so, yes, they had 4 cord avulsions. I have emailed them back to try and see what other information I can get. I have to say, as a researcher, it's very sad when colleagues don't reply. I can't make people reply, and you know, when I ask questions, I just hope as researchers that they feel that there is value in doing that. And if you follow it down, there was one neonatal death, and that was from a baby that had a cord avulsion. So, you know, we are aware these complications can happen, but what we need to do is try and find out why, because 4 out of 144 is a high percentage. It is a high percentage. And obviously they had none on dry land. They did have some positive C-reactive protein results, but 6 versus 4 is not statistically significant. And then you turn it round, because then they had less neonatal admissions to their neonatal ward. In fact, they had none in water, but they have 1 on dry land. So trying to look at data and work it out can be difficult. The other one that's in red, which I found a bit strange, because they talk quite a lot about maternal outcomes, and yet the study is about neonatal outcomes. But there they said that there was a higher risk of maternal fever post-Purim. So not during labour. So again, that's the sort of questions I've tried to, find out from them. And then on the positive, less blood loss, less PPHs, less manual removals, and a low risk of episiotomy. And that I've challenged as well, because I want to know if they actually routinely do episiotomies on dry land, and would they try and do them in water? Because my brain is working, well, if you're not doing them in water, there always will be less than on dry land. So that's what I ask. Excuse me. What was good that they did say that obviously we need to be trained to diagnose if there is a cold avulsion and actually deal with it immediately. And again, that's one of the things I do when I teach about how we deal with any complication. So that literally is fresh off the press. What about women's perceptions? Because I said, the qualitative information is just as important as the quantitative. And again, just some recent studies, there's been quite a lot coming out in the last couple of years. But look in mauve, if you would, if you've got a colour screen, what's said about it being liberated and transformative. That's from Claire Feely in the UK. In Ireland, they felt, this is again the Republic of Ireland, that there was a lack of information, accessibility to the pool. Remember, this is from the women, and dissatisfaction with the current model of care and service. Portugal, there's another one coming up from Portugal in a minute, looking for respect and affection, develop relationships and promote cooperation, inner healing, unnecessary interventions, and supported by their partners. And then the final one is from Canada, again, a big study where 52% of those women showed an interest in WaterBirth if it reduces pain and it's risk-free from the newborn. So very different angles that women express when we talk about women's perceptions. So yeah, that's just a few. And then this one came out, again, just a few weeks ago, from Portugal. Very, very different angle. And that's why having simple things like Google alerts, because look at the Journal of Religion and Health. I can assure you there's no way I would be subscribing to that journal. So that's the beauty. Google Alert brings these other things in, because they're talking about the spiritual experiences of Portuguese women who had a water birth. Very, very interesting, different angle. It wasn't big, again, 24 women, but they came up with those three spiritual related categories, they've called them. Beliefs and connections with your body. Well, I talk a lot about that when I'm talking to parents. Spirituality. Integration of being a woman and transformation during birth. Well, we know that. We talk a lot about that, but perhaps not seen in a spiritual way. And then the spirituality is wisdom, intuition, or the sixth sense, perceived in a woman's faith and beliefs in a superior being that help them manage the unpredictability and uncontrol. Now, that one I haven't replied to yet, but I need to talk to DeCosta, because I'm fascinated by this, absolutely fascinated. And it's the first time I've ever seen an article, a study in this sort of context. So there's some interesting items out there. And then this one, this came up literally as I got back. It came up on my alert when I checked yesterday. Now, the two photos are both of this place. This is Girona in Spain. Beautiful city. If you've never been, highly recommend it. But I was there last month teaching in one of their hospitals, and that's obviously us in the usual pose that we always do with WaterBirth. Let's all get in the tub. So that's typical. But this is a potential experimental study they want to do. As I say, it's not yet running. I'm hoping that the unit I was in will join in with this study that's being held at the university. Haven't heard back from them yet, but I'm hoping they will join in. I'm sure it's not just because I nagged them, they were already planning this, but it's been quite useful to see that other places are moving forward. They are, catching up and starting to collect their data and starting to join together. So it's not just an individual unit. What about us? We're often forgotten when it comes to, studies and, how important is this for us? So over the years, I've done various surveys, studies, questionnaires, various things. And then there have been 2 new studies that have come out from 2 very diverse backgrounds, one in Malta and one in Saudi Arabia. And again, if you read their papers, the same things come up, whichever country you look at. So, yeah, as practitioners, mainly midwives, but there are lots of countries where it's doctors who do the water births, always want to provide senior support and colleague support. Goes without saying, where water birth doesn't move forward, and it's not unique to water, you could probably say the same about things like complementary therapies and home birth, possibly even birth centres, but you need that support. If you haven't got it, things come to a grinding halt, and sadly over my career I've seen that. So yeah, of course we need support. We need education and training. And people often say, oh, but it's the same thing. Well, that's not how I see it. For me, the education is the discussion, the opening gambits about, which women may or may not use water. And if they can't, what's our rationale for that? GBS, VBAC, the high BMI, those women I mentioned earlier. Whereas the training for me is much more what to do if there is a complication. What do we do if there's cord avulsion? What do we do if the woman starts bleeding? All those, I call them the what ifs. What if there's meconium? So that to me is the training part. Not black and white, but it's a bit more fixed than the education with all the reflection. Of course, we need guidelines for care. And it's quite amazing, if people share their guidelines. Some are like, actually with me book, some are like little books like that, and others are just, one piece of paper. So that's really interesting. And that even exists in the UK. It's not just around the world. We need to often look into things like change management. If we're not getting the support, why aren't we? What can we do about it? How can we problem solve in normalising birth? People always want the appropriate equipment. I have real strange thoughts about why it is that midwives will accept substandard equipment, or even worse, no equipment at all, to support a woman with a water labour, water birth. And yet, if you look at other disciplines, our anaesthetist colleagues, there is no way they would put an epidural in for a woman without appropriate equipment. So why do we accept it? But of course they don't. Is that a powers thing? Who knows? So that comes up a lot. About empowering women. That's great to have that in there about what we feel, but do we feel empowered? Because if we don't feel empowered, how can we possibly empower women? So again, a lot of the discussions often are about your own environment. How do you feel empowered in your environment? And can you therefore empower those women? And there it is, of course, dealing with emergencies. The picture there is one that I've used for many years. It was actually a picture in a frame that I bought at a conference in America many years ago in Oregon. And I just think it's fab because you've got the mother and the baby at the centre, and then the guiding hands around her. And if you notice, they're not even touching her, which is the whole issue with water. And then she's in the water. So I've always loved that photo. So I do use that quite a lot because, like I said, a picture says 1,000 words. About the pool study, and that's what it's called. It's the pool study. First reported on actually at one of our festivals, so I don't know if you remember that, back in January 21. And the initial 3-site review was undertaken, although there were a lot more units involved, showing about the usage, which we've already mentioned. That's quite a high figure. They're saying 19% of women use water. Most people quote 20% will get in, 10% will get out, half will get out. So they're probably right on their actual entry to the water. But look at the difference between usage in different environments. What they didn't collect, although I'm hoping in the final report, because it was commented on, there's nothing in there about usage for home. So obstetric units, you can see at good 5%, alongside birth centres, some 31%. And the freestanding one, I was surprised in that first report that they only said 61% were using water, because I've certainly worked with alongside colleagues who work in freestanding birth centres, and they say it's more like 80–90%. So it'll be interesting to see what that final report, which is being presented in September, which I'm going to. It will be also, I put it purposely in the middle, because it will be interesting to see if the limitations below, which were raised in that first review, have changed. Again, please look at the dates, remember what's happened for the last couple of years. So midwife training, I put everything on Zoom. Not easy to do practical things on Zoom, but you know, you have a go. Culture and staff attitudes. Have they changed? Parents' information, I sadly think not a lot in many places. And there again is the pool availability. So that is going to be a really good review and a final study for us to look at. So that's me. Hope it wasn't too much of a whistle stop. What I would say is a couple of things that have been ongoing and will carry on. There's a new pod review called the OBS pod, as in obstetrician, the OBS pod, which I've only just come across. And a wonderful NHS obstetrician, who maybe we should get on to talk soon, called Florence Wilcott. And she's done a 25-minute pod, which I only listened to last night. And it's fab. And for an NHS obstetrician, she'll tell a story. It's really good. And then the final thing, which I have mentioned a couple of times, because I'm very excited going to Bali. This will be my 12th ICM. My first was in 1990 in Japan. And I'm presenting a poster there of a woman who had a fairly complex history. I'll give you a brief, because hopefully if anyone's coming to Bali, they'll come and see me in my poster. First of all, this was during COVID. She'd had a previous 4th-degree tear, and on the Zoom talk with the consultant was sort of indicated, well, let's book you for your elective section. And she said, well, I don't want an elective section. I want a WaterBirth. And immediately, you know, the barrier went up. And she then told him she also wanted it at home. So she had huge issues, the 4th-degree tear, COVID, at home, and wanting water. And I met her through her doula, and doulas are often not always mentioned that much. And I have a fantastic group of doulas that I know and work with. And it was her doula that contacted me, and we worked through it. We took all the pros and cons, gave her as much information as I could. And she had the most beautiful home water birth with a tiny little tear. We've written it up for one of the other journals, one of the colleagues who is on the advisory group. And I'm taking her whole story, including photos, with me to Bali. So I have to thank Kathy, her doula, and Emma, the mother, who will always know that I, you know, give them credit, because all I did was provide the information. That's all I did for them. And that's me, Sue.